It's not often that Marjorie Taylor Greene becomes the unexpected voice of reason inside the Republican Party, but this week she did exactly that, and it's sending shockwaves through Washington. In a move no one saw coming, Greene publicly broke ranks with Donald Trump, House Speaker Mike Johnson, and much of the GOP leadership on one of the most sensitive issues facing millions of Americans, healthcare. What she said, and the ripple effects it's already causing, could reshape the entire political conversation heading into 2026. In a long and fiery post, Marjorie Taylor Greene took to Twitter and delivered what can only be described as a political earthquake for the Republican Party. She wrote, quote, "I was not in Congress when all this Obamacare, Affordable Care Act started. I got here in 2021. As a matter of fact, the ACA made health insurance unaffordable for my family after it was passed with skyrocketing premiums higher than our house payment. Let's just say as nicely as possible, I'm not a fan. But I'm going to go against everyone on this issue because when the tax credits expire this year, my own adult children's insurance premiums for 2026 are going to double along with all the wonderful families and hardworking people in my district. No, I'm not towing the party line on this or playing loyalty games. I'm a Republican and won't vote for illegals to have any taxpayer-funded healthcare or benefits. I'm America only. I'm carving my own lane. And I'm absolutely disgusted that health insurance premiums will double if the tax credits expire this year. Also, I think health insurance and all insurance is a scam. Just to be clear, not a single Republican in leadership talked to us about this or has given us a plan to help Americans deal with their health insurance premiums doubling. That's not a Democrat. That's Marjorie Taylor Greene, one of Donald Trump's most loyal foot soldiers, now publicly saying she won't toe the party line. For many observers, this marks a turning point. It's not just a Republican expressing discomfort over policy, it's a sitting member of Congress calling out her own leadership for abandoning millions of Americans on one of the most important issues in their daily lives: how to afford healthcare. Of course, some of what Greene said was factually wrong. For example, her suggestion that ACA subsidies or any federal funding for healthcare go to undocumented immigrants is false. By law, federal ACA subsidies are only available to citizens and legal residents. But that aside, her larger point, that insurance premiums are about to skyrocket, is very real. And for the GOP, the political fallout could be devastating. Let's break down what's actually happening. Under the current structure, the Affordable Care Act provides federal tax credits to help middle and lower-income Americans pay for health insurance through the marketplace. These subsidies were expanded under President Biden's 2021 American Rescue Plan and later extended through the Inflation Reduction Act, lowering costs for millions of families. But those expansions are set to expire this year. If Congress fails to act, roughly 24 million Americans who get their coverage through the ACA marketplace could see premiums double or even quadruple in 2026. The Kaiser Family Foundation recently published polling data that drives home just how urgent this issue is. Nearly 8 in 10 Americans, 78%, want Congress to extend the expiring ACA credits. Only 22% say they should expire. That includes majorities of Republicans, Democrats, and independents. Yet, despite that overwhelming public support, Republican leadership has refused to commit to an extension. And this is where Greene's comments become so politically explosive. By publicly admitting that even her own family, and her adult children, would be hit hard by the expiration of these credits, she's acknowledging a political reality most of her colleagues won't. The GOP's hardline opposition to the Affordable Care Act is no longer just hurting Democrats. It's hurting their own voters, their own districts, and their own base. To make this point clearer, Greene's statement was immediately contrasted by comments from House Speaker Mike Johnson, who appeared on Fox News and said the following. So they created a red herring. A red herring is a distraction. They decided that they would pick a fight on healthcare. Let me look right into the camera and tell you very clearly, Republicans are the ones concerned about healthcare. Republicans are the party working around the clock every day to fix healthcare. We are not. This is not talking points for us. We've done it. A big part of the One Big Beautiful Bill, the Working Families Tax Cut, was to fix healthcare. Healthcare is broken in America. It's too expensive. The quality of care needs to rise. We need more access for more people, and we have lots of ideas to do that. But that issue is for debate in the next few 3 months. It always was. We have members working on that. But that statement quickly backfired. Because when Mike Johnson insists that Republicans are the party working to fix healthcare, the evidence just doesn't support it. The so-called Big Beautiful Bill he referenced, the Working Families Tax Cut, slashed healthcare funding by roughly $1 trillion, primarily to pay for tax breaks for the wealthiest Americans. That bill alone is projected to result in 17 million people losing Medicaid coverage, while hundreds of rural hospitals across the country face closure due to funding shortfalls. So the question becomes, what exactly is the Republican plan to fix healthcare? After 15 years of trying to repeal the Affordable Care Act, 77 separate repeal votes, in fact, the GOP still doesn't have a clear alternative. Even after years of promises to replace Obamacare with something better and cheaper, there has never been a cohesive legislative proposal that achieves those goals. Meanwhile, the numbers tell a devastating story. Since 2020, ACA enrollment has more than doubled, rising from 11.5 million to 24.3 million people in 2025. That's a 113% increase in just 5 years. And here's the twist that makes this so politically fascinating. The fastest growth has occurred in Republican-led states that overwhelmingly voted for Donald Trump. Texas saw a 255% increase in ACA enrollment. Mississippi's enrollment rose 242%. Louisiana and West Virginia both saw increases above 230%. Georgia and Tennessee each saw enrollment rise by over 220%. On average, enrollment grew by 157% in states won by Trump in the 2024 election, compared to just 36% in states won by Kamala Harris. So who will be most affected if ACA subsidies expire? Ironically, Trump's own voters. Millions of low- and middle-income families in red states rely on these subsidies to afford health coverage. For them, losing the tax credits means their monthly premiums could jump from under $100 to over $1,000, a financial shock that could force millions to drop coverage entirely. Some senators have already started sharing screenshots from constituents to illustrate the problem. One tweet shows a family's current $37 monthly premium jumping to $964 in 2026. Another shows $228 rising to $1,142. These aren't partisan talking points, they are real people's lives. So when Greene says she's disgusted that leadership has no plan, she's speaking to something most Republicans quietly acknowledge, but rarely say out loud. Trump's political strategy is increasingly detached from the economic realities facing ordinary Americans. The irony is hard to ignore. Donald Trump's One Big Beautiful Bill, hailed as a victory for working families, cut the very programs his base depends on. And now, even his most loyal allies are realizing the cost. Bernie Sanders, in a recent interview, described this dynamic perfectly. He said, "The major goal here, as part of Trump's Big Beautiful Bill, was to give $1 trillion in tax breaks to the 1%. Elon Musk puts $290 million into Trump's campaign. Other billionaires put money into Republican campaigns. They want to be repaid. And the way you repay them is through massive tax breaks. So that's number one. Number two, Republicans have never liked public insurance programs. They've tried to privatize Social Security, Medicare, Medicaid, and the Veterans Administration. So you get a twofer, you cut funding for working families while giving tax breaks to the wealthy, and you move closer to privatizing public health. That's the heart of the issue. What Greene's rebellion reveals is not just internal division, but the beginning of a larger reckoning for the Republican Party. Trump's hold on the GOP has forced many lawmakers to align with policies that actively harm their own voters. But as the costs mount, cracks are beginning to show. Will Trump reverse course? Possibly, but only if the political damage becomes unbearable. Historically, Trump has shown little hesitation to backtrack when something becomes politically toxic. But for now, the strategy remains scorched earth. The question for Republicans in Congress is simple. How much longer can they continue to follow a political strategy that hurts their constituents and risks their re-election chances? With healthcare costs soaring, Medicaid cuts looming, and millions about to lose affordable coverage, the clock is ticking. Greene's public defection could be the first of many. It's not ideological, it's survival. When voters start feeling the effects of doubling premiums, they won't be blaming Democrats. They'll be asking why their Republican representatives did nothing. Meanwhile, Democrats are seizing the moment. President Kamala Harris and Senate Democrats have already begun framing the GOP's inaction as proof that Republicans don't care about working families. Expect to see campaign ads featuring those $37 to $9.64 premium increases running in swing districts across the country. The political stakes are massive. Healthcare has always been a defining issue in American politics. But this time, the ground has shifted. It's no longer a debate about ideology, it's about affordability, survival, and trust. And as even Trump's closest allies start to break ranks, the GOP faces a moment of truth, double down on chaos, or finally face the consequences of its own policies. So where does this leave the American people? Frustrated, anxious, and uncertain. For families across red and blue states alike, healthcare isn't a partisan talking point, it's the difference between security and catastrophe. And as premiums rise, coverage shrinks, and leadership remains paralyzed by infighting, voters are demanding real solutions, not slogans. Because let's be honest, when even Marjorie Taylor Greene can read the political landscape and say, enough is enough, you know something fundamental is shifting. Before you go, what do you think? Should Republicans break with Trump and support extending the ACA tax credits? Or do you believe the GOP has a better alternative waiting in the wings? How do you think skyrocketing premiums will affect the 2026 elections? And do you trust either party to fix the healthcare system for good? Let us know your thoughts in the comments below, we'd love to hear what you think.